Good afternoon, everyone. This is Oluwakemi. Some weeks ago, I mentioned the fact that I'll be meeting with some of my colleagues to ask them about what they do in their respective unit or department and to educate others so they could learn one or two things from what they do in that unit. So today with me is
Abdulatif Aisha
from
Labour Ward.
Today with me is Nurse Abdulatif from Labour Ward, and she'll be telling us some things that pregnant women after delivery need to know. So I'll be asking her some questions, and I believe you will get to learn one or two things from her this afternoon. Let's get right into it. Nurse Latif, good afternoon. How are you doing, ma'am?
I'm fine. I'm
All
very
right, so
well.
it's good to have you here. I believe you are set for us.
Yes,
All right, thank you so much. So the first question I'll be asking you is that you've been in Labour Ward for how long now?
up to a year.
A year. How has it been working in Labour Ward for this past 1 year? What has the experience been like, especially with patients? Because you get to see some difficult patients,
Yes.
patients that are cooperative, and how has it been for this past 1 year?
Actually, it's been good. I mean, meeting new people, patients, and receiving life. But we are different and different personalities. So there are some things that expectant mother needs to know, because the moment you are coming from your home, coming to the hospital, you are meeting different kind of people too. I mean, the health worker, and they are there to serve your needs. So you are expected to cooperate with them, do what you are asked to do, although they are not mandating anything on you. But you have to be cooperative. Make sure you do what you are expected to do.
That means the place of patient cooperating with the nurses cannot be overemphasized. So if you are seeing this video, you're pregnant or you are an expectant mom, please note that it is very important that when you're about to deliver, you cooperate with your midwives, birth attendant, doctors, and nurses. This is very, very important because they're not going to force you to do anything. You are going to give them the maximum cooperation. I've seen some cases whereby after the baby is out, the mother refuses to allow the nurses to carry out the next line of action, because I believe that delivery does not end after the baby is out.
Exactly.
There are other things that are involved. So could you please tell us what are the things involved after the baby is out? What are the things that the woman who just delivered is expected to do after the baby is out? Thank you.
Yes, ma'am. The moment the baby is out, they put the baby to your chest. They will tell you, hold your baby for some minutes. They will separate the placenta from the baby. They will separate the cord, ligating the cord. After that, the other nurses or the other health care attendants will take care of the baby. After that, they expect you to at least cooperate, because you have the mindset that the baby is out, I'm fine. But that is not it. The moment the baby is out and the placenta is not yet out, that calls for a serious alarm. They give injection, madam, please relax. I have not congratulated you. Yes, that's it. Because if they have not congratulated you, definitely that means the placenta is not out. And sometimes there are some challenges that we face when the placenta is not out. Probably the uterus is not contracting, uterine atony, or the bladder is full. So they will help, madam, let me help you to empty your bladder, rub your uterus and all that. But some patients may be uncooperative in the sense that they feel the baby is crying, there is nothing more. But your life is at risk at that particular moment. Because if the placenta is not out, you may start bleeding. Okay, let's say the placenta is out and they said, madam, there is still some product of conception. Probably the placenta is not out completely, because there are some placenta that will not come out completely. Probably there's some membrane retaining inside the uterus. So they will beg you, madam, please let me help you to expel some product of conception that remains. Because if there is a tiny membrane of placenta inside the womb, the woman might bleed to death. That's it. We want you to be cooperative. It is painful, yes, it is painful, but the pain that you go through during the delivery is different from this one, because your life is at risk.
Thank you so much. So what you just said now is that if after delivery of the baby,
Yes,
the
ma'am.
woman refuses to cooperate for the midwife to expel the clots, to deliver the placenta and the membrane, there's likelihood of the woman bleeding to death.
Yes.
All right.
Yes.
All right. All right.
Yes.
So, all right. So, thank you so much, Nurse Abdulatif. I
Yes,
believe
ma'am.
we have a lot from you, and I believe our viewers have learned or will learn one or two things from what you've said. Once again, thank you, Nurse Abdulatif,
Yes,
for
ma'am.
honoring this call. Thank you so much. I really appreciate you.
Yes.
We'll be having her around some other time so we get to learn
Right.
from her. If you have any question, you need clarification on anything on what she has said so far, do not hesitate to put it in the comment section. Thank you.
Thank you.
All right.
Yes,
Bye.
ma'am. Bye-bye.